what we mean when we talk about suicide and suicidality as a clinical term. We mean that you've thought about how to commit suicide, but not just the thoughts. You've perhaps thought about how to do it. You've thought about methodology, which different way would make more sense or you have easier access to. And then there's also a time element to it, that you're planning on it in actuality. You have a real plan. You'll see people who think about how to write a letter to someone, or you'll see people who, since they're ending their job, will start to clean up their desk. There's a reality to it. It's not just the thoughts, it's that now it's becoming real and they are preparing for it. So as a clinician, we tend to ask questions to try to understand how practical has this become for you. And as a manager or as a friend or as a colleague, you can ask the same questions. If someone mentions something like, I think I'm just done, I don't want to live anymore, you can actually ask, have you thought about how you would do that? And if they are suicidal, they'll have an answer to that question. Our tendency is to be afraid of asking those questions, but actually it's generally a relief for people to talk about it. So it's one way of helping others to think through, has this become practical for someone? When you hear that hopelessness, that's a good flag to listen to that and ask questions and press into how can I help you think through maybe some solutions or have more hope for your situation. There are some symptoms, especially as someone gets closer to committing suicide. You might see a change in behavior. You might see someone who is usually quite outgoing become withdrawn, sullen, they don't talk to people. Someone might become very isolated. Those are usually right before the suicide happens or the attempted suicide might occur. If you are feeling suicidal, I would suggest that you talk to somebody. That's the first thing. Find someone that you really trust that will listen and talk about how you're feeling, and make sure that you use language that conveys how serious the situation is to you. So that's the first thing. If you've asked for help and you seem to not be getting any, keep talking until someone really listens to you. The other thing I would suggest is notice the situations in your external life that feel hopeless. And is there anything you can change about those situations? Can you get out of it? Can you walk away? Things like that might help you help the situation feel like it has some more hope in it. And lastly, I would say seek help from a clinical counselor who knows the subject of suicide or depression or anxiety, however you're struggling, and try to get access to that help as soon as possible.